Do you divide your practice up into two parts, a clinical section and a hygiene section? Most dentists do. They have a hygiene practice where patients will see the hygienist. It's usually the beginning part of the practice. So when you walk in, those are the hygiene rooms. And then there's the clinical area. In our practice, our first 3 rooms are hygiene, and then the next 4 is the clinical suite where we do surgery and do examinations, etc. My goal in our practice is to keep everybody into the hygiene room so they don't have to go to the clinical area. So when a patient enters our practice, they don't enter through the hygiene room. In about 90% of the practices in the United States, patients will call the dental office and they'll say, I need to make an appointment to get my teeth cleaned, and then the dentist will come in and they'll do an exam in the hygiene room, and then they'll try to schedule some treatment from the hygiene room to the clinical area. In our practice, we do it differently. It's my recommendation because I think it's a more effective way to treat patients, and you'll be able to do a comprehensive examination, a diagnosis and treatment plan before you clean their teeth, because sometimes patients may need more than just a simple cleaning. Maybe they need scaling and root planing or comprehensive care. So we'll see them in the clinical area, schedule their treatment, and then complete all the treatment that they need, and then they'll go into the hygiene area for maintenance. So the goal in our practice is to get all of our patients into the hygiene rooms and not into the clinical rooms. They enter clinically for treatment, comprehensive treatment, and then they go into the maintenance phase. So in our practice, hygiene is maintenance. What does that mean? We want to maintain good oral health. We want to maintain periodontal health. We want to maintain dental health, occlusal health, aesthetic health, no oral cancer. All of the things that we look for in a comprehensive examination, we want to be stable in the hygiene room. Our practice is a little bit different than other patient practices. Because for me, if I pull a patient from the hygiene room who's been a patient for 10 years into the clinical room, I know that something's failed. Either I haven't failed it. I failed them clinically, I failed to educate them, I failed to motivate them to come back, they stopped brushing and flossing, etc. But that happens. 85% of our patients don't come back routinely. They go on, sabbatical. They don't usually go to other periodontists, they just stop coming for a period of time. So in our practice, our goal is to get people healthy so that they don't have to go back to the clinical area. Unfortunately, a lot of dentists look at their hygiene practice as what do they say in insurance, an annuity. An annuity so they can find some work to do to go back to clinical. So in the hygiene room, my point of view is a little bit different. I look to make sure everything's healthy. I don't want to find anything wrong. And my patients know that because at the beginning of treatment, I get them to commit to go to the hygiene area. I get them to commit to go there to maintain their health. And I tell them before we even begin treatment, that treatment falls into 5 different phases. Number 1, I want to get you out of any pain if you have any. Number 2, I want to eliminate any infection, caries, decay, endo problems, periodontal disease, etc. 3, I want to functionally rehabilitate you. 4, aesthetic rehabilitation if you need it. And 5, which is the most important, maintenance. Just like with a car or a house or your body or anything else, maintenance is the key to success. So that hygiene room is very, very specific in our practice. I worship that area. It's an area where I want people to stay healthy and keep healthy, just like I do with my own body's health. I want to keep as healthy as possible. I don't want to have to go into rehab. If I exercise, I want to make sure I don't exercise to the point where I need to go to rehab. I do the same thing with my patients. I want to get them healthy so they don't have to be rehabilitated again by maintaining them. It's just a different way of looking at the way we practice. Have a good day, everybody, and make sure that you try to keep people in the hygiene room and not in the clinical area, but start in the clinical and then go to the hygiene. Be the gift.